Hi, everybody. I'm Jennifer Griffin. I actually now work for the foundation. I gave up my entire life for LGS, and happily so, let me tell you. I am the Director of Family Support Services, so I've only been here since September, and I've been charged with talking to you about resources that you need to know. So that's kind of intimidating for me because I am talking to a room filled with people who know lots about resources. I was trying to figure out, where do I start with all of this? And I kind of overthought this long and hard, and I settled on 4 main areas: health, financial, recreation, and personal safety. And then I'm going to sprinkle in maybe a little general info in there as well. But I'm going to tell you guys how I arrived at these 4 topics. Okay. Anybody know what this is? Anybody have any idea? Shout it out if you do. It's my brain address? Yeah, thank you. That's true. Well, that too. This is called a system support map. And this is actually a really good tool for revealing the complicated array of responsibilities, needs, and resources and wishes that families have. And I am actually a graduate of the Family Scholars Program through the Association of Maternal Child Health Programs. Yeah, applaud that, Dale, because you don't know what it is. But it's a government program, and I did this long training, and this was one of the things that they showed us. And I thought, okay, sure, whatever this is. And I got started on it, and I was actually blown away by the responsibilities in my own life. The association, it's called a systems support map. If you Google this, you'll see all kinds of different system support maps, and they're really cool. And they can look multiple ways, and you can do it for business, you can do it for your personal life. And in this case, I'm doing it specifically for my life as Theo's mom. So if you look at it as a bullseye. And at the very center of that bullseye, it just says, Jennifer, mom. That'd be me. Okay, so then you widen out to the next circle in this little bullseye, and it says role or identity. And it'll say, and my role, I am the mother of Theo, a 16-year-old boy with LGS. So great, that we can all relate to that so far, right? So now we get to the fun one, which is most important responsibilities. And this is something we all personalize for whatever, suits our needs. And for me, I've put it down to home, personal safety, education, recreation, health, and financial. Okay. Then we broaden out to general needs for each one of these responsibilities. And I'm not going to go through everything, by the way, so don't worry. But I'm just going to highlight a few areas like maybe, health, right? We've got specialists, we've got their diet, we have therapists, we have primary care. And for personal safety, we have things like constant supervision, the need for equipment, the need for a safe environment. So then we go out to the last circle, and that is available responsibility or resources for each of the responsibilities for those important responsibilities for the role of Jennifer mom. So all of those available resources, for example, finances. I'm from California, and for those of you who are from California, we have 4 payers in California. You have your regional center system. You have something called CCS, which is California Children's Services, IHSS, which is In-Home Supportive Services, and Medi-Cal, which is the Medicaid program in California. And everybody's state looks a little different, but those are like the 4 payers, with the regional center being the payer of last resort. Let me see one of these other ones that I might talk about. For health, for therapists, right? My son has vision, orientation and mobility, speech, OT, PT, APE, ABA sometimes. So, that list alone can probably look pretty crazy for all of us. But the one that I like is not contained within a circle. It is the outside of the circle. And that's what you call your wish list. And you can have fun with that, or you can be kind of a little bit more realistic. Like my wish list, of course, is a cure for LGS. You know, don't we all have that same wish? But my other wish list, because I live in a very expensive city, is that I could win a lottery. That is, you know, because I don't own my own home, and I probably never will until I win that lottery. For the purposes of this presentation, though, I'm not going to talk about home, and I'm not going to talk about education. Home is really subjective; it's personal. But education, there's going to be somebody talking about that tomorrow. So I thought I would just do the financial, health, recreation, and personal safety. Okay, so let's start with financial. Okay, this is the big headache for all of us. Waiver programs are confusing to locate or understand, so I think this very first website, by the way, most of what I'm giving you is going to be just, you know, information on different websites. It's going to be just a taste of things. Kidswaivers.org is I found it to be a pretty useful website because it really is good at speaking in plain language about all the multiple different waiver programs, TEFRA or Katie Beckett waivers, 1115 demonstration waivers, 1915 HCBS waivers, and the state-based waivers. And they all use the word waiver because they are waiving parental income. It is helpful, the Kids Waivers website, because they break it down state by state. And, you know, in my job at the foundation, if somebody calls me and says, hey, I'm in Delaware and I don't know how to get a waiver, you know what? Neither do I, right? Because I don't live in Delaware. But I kind of know where to go. And then I might hopefully have an ambassador in Delaware, and I'll talk about that a little bit later, who can maybe help you out. But really, it's going to be different from all of us, from one state to the next. So it can be sometimes very complicated, especially in our Facebook group, when somebody says, well, why don't you just do the such and such? And it's like, well, that's in your state, not in mine. But this is a good, the Kids Waivers they've utilized the government websites. So I've also included in there Medicaid.gov. They rely on families reporting to them their own experiences for the inside scoop about the programs in the state, because sometimes this stuff is really good on paper, but in theory it doesn't really work. So I thought that was a really nice little thing that they do. And then below, we've got Partnership for Prescription Assistance. We have these patient assistance programs, and these two links that I've added provide information on applying to programs that offer free or low-cost drugs to those who are unable to pay for them. The next slide that we're gonna talk about is health. So when I looked at that systems support map in the beginning, one of the great needs I know in my life, and I'm sure in most of yours, is the need for specialized services. So this could mean for a lot of us out-of-state travel. So access to some of these specialists or special procedures that we want our children to go to in a different state, that can be really challenging. So there are these volunteer pilot organizations, and they're nonprofits, and they offer free flights to families who require travel for medical or life-saving purposes, and so I'd say non-emergent life-saving purposes. So they're not going to airlift your child somewhere. Now, I actually spoke with somebody at Angel Flight East, and Angel Flight has East, West, Northeast, South Central, Mid-Atlantic. So there's a lot of different chapters around the country. You would have to contact your local chapter or the one that's nearest to you to find out exactly how they operate. Because when I spoke with the guy at Angel Flight East, they were really accommodating. They say, we could take your child to a doctor's appointment and home all in the same day, or if need be, or they can drop you off and then come and get you a few days later if that's the case. But what they can't handle are wheelchairs. So that was kind of a drag. But that's not the same for all of them. So, it's just not all of these resources they're not going to be one size fits all, as we all know. but at least they're there for us, right? And the Pacer Center I also included because they're a great resource for national information on support, advocacy, and information about the healthcare system. The word advocacy is not the talk that I'm giving today, but it may be the talk I give at the next conference, because let me tell you, it is one of the things that I'm really concerned about. It's a skill that I've been spending a long time, the last 10 years or so, developing in myself, and just the feeling that you get when you know how to speak up on behalf of your child, and it becomes less intimidating, and you don't have to know everything about the political system and about every bill that's going down and how they all got to there. You don't have to know all of that stuff, but what you have to know is enough that you can strongly stand up and tell your own story. So that will be a bigger topic down the line, maybe for a webinar, because I'm going to be probably putting together a lot of webinars in the next few months. And I think that it's something that I really hope that you guys have a lot of interest in. So the Pacer Center works effectively with doctors and other healthcare professionals and providers. They develop family-centered care plans. They have information on SSI and appeals processes for insurance and government assistance programs. And they also have webinars and workshops that are available. And the First Hand Foundation, the reason I included that, by the way, is that we have a lot of people here from other countries. And unfortunately, most of what I'm talking about today is not going to be as useful for you, although it's really good to know that it exists, so that maybe you can see if you can find something that's replicated in your country. But this one provides funding both domestically and internationally for medical care, equipment, and travel related to medical care when other financial resources have been exhausted. And then NORD is the National Organization for Rare Disorders, and this is a great one-stop shop. And they have information ranging from fact sheets to webinars to patient assistance programs and updates on clinical trials. Okay, so personal safety. One thing is almost certain when you have a child with LGS. They come with a lot of equipment. And some examples of durable medical equipment could be things like oxygen equipment, hospital beds, mobility assistive equipment, wheelchairs and walkers and standers, and activity chairs and helmets and commodes and bath chairs, etc. So lots and lots and lots of information. And I included the obvious ones, or at least the ones I consider to be the obvious ones, like Danmar and Convade and Riften. I'd say that, I look around, I see lots of Convade chairs. I see lots of kids wearing their Danmar helmets. And I know that, I wish we should have taken out stock on that company, because my son, he's a big dude and he likes to sort of wreck his stuff. So, we've gone through lots of helmets and you name it, and wheelchairs. And those things are not put together very well for they think that they're going to be these little fragile beings inside of their, no, some of them like to jump up and down and rock back and forth, and, all of the nuts and bolts start falling off. But I digress. So I also included some general info, and that is abilities.com. I found that website, and what I really liked about them is that they broke it down. They have a resources page that breaks it down into categories: intellectual disabilities, sensory needs, adaptive sports, assistance animals. And of course, as we all know, when we go to our favorite resource, the Google, or its very close cousin, Dr. Google, I find that, it's like going down a rabbit hole. You go to the resources page, and then it takes you to a whole bunch of other links. So then you go to those, and then you go to their resources page, and then so on and so forth. So everything I'm giving you today is hopefully going to take away those many hours of your life that you suddenly look up and say, oh my God, I've been on my computer all day just going from one website to the next to the next. So these are just some really, nice, useful information. So I put the OptiCool headgear in there because I looked on their website and I thought, wow, My son, with the summer coming, he overheats. And when he overheats, he has more seizures, right? And, nodding heads. And I liked the look of their helmet. I don't know if anybody's used their helmet, but it looks really well ventilated, and you can put gel packs inside, like cooling packs. And I thought, oh, that might be something that I hit up next, because that guy's got some wet do-rags on his head most of the time just to chill him out. Okay, so the next one is kind of the fun one. It's recreation. And I say it's fun because it involves thinking of our kids with LGS like we would our typically developing kids. We forget that. They need to have fun, right? But it is a little bit more challenging to find those organizations where they can have fun. And I know last week in Santa Barbara, we had a Special Olympics Day for all of the special ed programs in the county. In a big stadium, we had the firefighters and the police there, and they were handing out ribbons, and the kids were doing, like my son was doing the 25-meter walk and the tennis ball toss with, somebody doing hand over hand with him. But he was participating, and the parents were cheering them on. And that's one of those dreams that we think dies when our kids have special needs. We think that we can't have that kind of regular Saturday morning experience. But let me tell you, Challenger Baseball, Little League, every Little League has the capability of having a Challenger program. You just have to approach them if yours doesn't have it. And a mom in my area did that many years ago, and we started Challenger Baseball, and I coached my son's team. Like, do I look like a baseball coach? I don't know. I don't know if I look athletic, but believe me, I'm from Canada. I played hockey. And I never played baseball, but I could coach a team of kids with a lot of interesting medical needs and behaviors easily, because they were so fun, and it was like organized chaos, and the parents could just sit in the stands on a beautiful Saturday morning and just, mingle with each other, be part of a community, but also celebrate their kids and get to have that regular experience, which I think is just awesome. Summer camps, I put the Easter Seals website up there because they have, I wanted to include all websites that have more of a national face to them, so that, a lot of them have links to most of the states, so that you can go onto that website and see what kind of camps are offered for your kids in your community. And it's not always a lot, because even if something is called a special needs camp, we all know that some of our kids have needs that are a little too special for them to handle, and that can be really heartbreaking. Summer is a really tough time in my family because I can't do much with my son. I can't really put him into a lot of camps because they'll say, oh, but those seizures, I don't know if we can deal with that. And I think, well, I don't want anybody who's afraid of seizures working with my son anyhow, but why does that have to exist? So hopefully you don't all have the same experience as I do. And it's not so bad. Anyhow, I'm going to try and be positive here. General stuff that sounds pretty good. That was my general stuff slide. And the reason I put this one up here is because, there's this complete list of free things and grants for kids with special needs. And so much of the equipment and the needs of our kids can be cost prohibitive. And sometimes there are grants out there. If you look hard enough, there are all kinds of little organizations that have started up that will have, a grant and this lists all kinds of different grant programs. And some of them, if our child doesn't have spinal muscular atrophy, no, they do not qualify for that particular grant. But there are so many on that list that aren't disability specific that I think that it's a really awesome place for you to check out. And there are others like that, I'm sure, out there. I included travel tips on here, which is kind of silly since you all traveled already to get here and you've probably learned those lessons the hard way. But just in case you forgot, this is the website that you might want to visit afterwards to get some information on tips for when you are traveling with somebody who has a lot of extra stuff and need. And if there are documents that you need to fill out, you might find some of them on that, or TSA hints and tips. And advocacy tips, well, I just did that because I keep wanting to just pop that word advocacy into this talk, just so that down the road we can really have a bigger conversation about that. So, what do we do when we can't find the money to pay for all the stuff? Okay, did you guys ever know how many things you could do with a swimming pool noodle? It's incredible. I went to a dollar store many years ago, and I just went, you know what, I'm going to buy that swimming pool noodle. I'm going to slice it down the middle. I'm going to put it over the corners of all the edges on all the furniture and the walls and everything, because my son can walk just enough, as Tracy had said earlier, kind of like they're a little drunk, right? I always say he walks like a drunken sailor. And he's just all over the place, and he insists on walking. But he falls all the time. And he's had more, broken finger, broken toe, stitches here, stitches there, biting his lip all that stuff. So I figure, well, the least I can do is try to help him as best I can. So I put these swimming pool noodles with duct tape over top of them. My house looks really sort of pink and green and blue and very colorful. But I don't care. He's safe. And and I think that there are all kinds of DIY tips. That's another talk that we can have, by the way, because I'll bet we all in this room have, little things that we just figured out on our own because we looked in one of those magazines for people with special needs and said, oh my gosh, look what they're charging for that thing. I can make that. And we did. So we're all pretty resourceful. Okay, so before I go on to my next slide, I just want you to all take a moment. And if there is somebody within reaching distance of you that you don't know, I want you to just reach over and touch that person on the arm. Come on, do it. We're all touchy-feely people here. This is a love fest. Good. Good. All right. Eyes back. So, as far as I'm concerned, you just found your best resource, right? Because other parents, who knows better than them? I was really lucky about 10 years ago to start working in a family resource center where I worked with families over the years. And I ended up running a support group. And we'd have these monthly support groups, and people would come and they'd share their concerns and their needs, or they'd have questions about resources or whatever. And so often I felt like, even though I was, facilitating this group, I would be writing down stuff like crazy. And I would walk away thinking, oh you have just changed my life, just with that one little tip that you gave me. Or those resources, those little DIY resources. Other parents, they're everything, right, to us. And, there are these parent-to-parent support organizations out there. Family Voices, Family-to-Family Health Information Centers, Center for Parent Information and Resources. They exist in every state. It is evidence-based. Parents really do. Listen, if it wasn't for family resource centers, I would have never found this. I wouldn't have been able to work because it became a career for me. And I was so grateful for that because not only did it helped me just in staying in touch with a community, but it also made me feel like I was doing something for Theo because, so often we feel so helpless, right? And I think that there are times, and look at our Facebook page, there are times when somebody is just falling apart, right? And sometimes it's you that you're falling apart. And we reach out to one another and we lift one another up when we really need that. And we also give each other such great information and great resources. Family Voices, I'll just read to you what their website says. It says, Family Voices is a national family-led organization of families and friends of children and youth with special health care needs and disabilities. They connect a network of family organizations across the U.S. that provide support. They promote partnership with families at all levels of healthcare, individual and policy decision-making levels. There's that advocacy thing again. In order to improve healthcare services and policies for children. And then family-to-family health information centers, Family Voices is sometimes part of that. They're all staffed by family members. And then the Center for Parent Information and Resources is funded by the U.S. Department of Education Offices of Special Education Programs, or OSEP. And their hub offers resource sharing, webinars, updated info that's gathered from parent centers across the nation. So obviously I can't say enough about that incredible resource. But the greatest resource, I think, that's available to all of us in this room is the one that has brought us here today. Us, the LGS Foundation. You know, if you're new to this, do we have a lot of people who are new to the conferences? Welcome, welcome. I'm so glad you've made it. I remember the first time I came to an LGS conference, and I was overwhelmed. I went home crying happy tears because it can be a very isolating, lonely life, and it doesn't have to be. And we have done everything here. We're a small team, but we are so connected to our community. And look at all these resources. I mean, if you haven't really mined through the website, do that, because we have patient assistance programs, and we have Give Kids the World. We have all kinds of programs. But the best one, as far as I'm concerned right now, is our ambassador program, because it's really growing. And we're trying to get ambassadors in every state. Because like I said, somebody in Delaware is going to call me, and I'll do my darndest to help them. But wouldn't it be nice if there was a parent in Delaware that is, has received sort of a training from us on how to be an ambassador. All of our ambassadors are charged with, getting meetups going in their state so they can have these little face-to-face meetups with one another. Maybe do some fundraising together, or just have fun, like a park day or a walk. Oh, and by the way, I was going to do that actually, Kara, but thanks, because I actually had forgotten that. Kara said, have the ambassadors stand up. Heck yeah. Okay, see this little red tag? Look for these people with these red tags. Stand up if you're an ambassador, please, and let everybody know. And we have some that aren't here today, so check out our website. But we have 4 regional ambassadors, and that would be Elizabeth over here, Kara here, Kaylee here, and Darla, who is the one selling jewelry out there. I don't know if she's in here right now. Oh, Darla, there you are. Yay. So and they are in charge of multiple regions. So if you find out that your state doesn't have an ambassador, hello, we need you. Also, if you have like all kinds of really awesome skills that you'll give away for free, we need that too. But anyhow, and then our Facebook group. We have a closed group that is a very strong support group. And Kara really, I think I'm talking to them right now, aren't I? Kara really does a great job, Kara and Kathy, of really keeping in touch with what the conversation is, so that we are making sure that there's nothing controversial or insulting or hurtful, and if there is, they, kind of gently say to somebody, hey, we're all here. It's a love fest, people. We're trying to give information and support one another, and some of us we're just gonna vent and say mean, ugly things sometimes because we're so frustrated, and that's okay, because we really do want to make sure that we can take you beyond that moment. But we all have our moments, and we get it. We also have a siblings tribe, siblings page just for the siblings, so parents, back off. We let them say what they need to say to one another, and because we really need to support our siblings, because I think let's shout out to the siblings, right? Always, always. Okay, so the last thing I want to talk about is we've put together this community needs assessment survey. And if you haven't filled it out, I think we've got maybe 60 people who have filled it out so far. We're going to post it in our, if you're not subscribed to our newsletter, that'll go out maybe next week at some point, maybe the beginning of the following week at the latest. And we'll have a link to that. It's also going to be on our Facebook group, or yeah, in our Facebook group again, as we, periodically we'll put it in the Facebook group. Please fill that out because we really need to know. It's so important to us to know what is important to you, what you want to hear about, what kind of stuff you need information on. And we're just trying to gather all that together so that we can just make our foundation continuing to be strong. Or you can also email me here. I've got my email, and I will happily send you the link to that survey. And just one more time, because it's so pretty and colorful. There you go, the system support map, and that's it. Thank you, everybody.